welcome back to my channel. Thank you so much for tuning in. Thank you for your continued support, and I want to welcome all the new subscribers. Welcome to the family. I hope you're going to learn 1 or 2, 3 things from me and also from the other subscribers. So guys, today I want us to talk about the Bewerbung and Bewerbungsgespräch to the nursing school. Bewerbung is the written application and the Bewerbungsgespräch is the interview, the main interview. Guys, the written application is the gate pass to the interview. If the written application is, as Germans say, scheiße, or is not really straight, you will definitely not be invited for the interview. Main application, the written application must be really like bam. It must be grammatically correct. It must be well arranged. The Lebenslauf must be well arranged. Your past photo must be really professional. So guys, what I want to advise you on that side is look for a job coach and let the person help you do the Bewerbung, Schreibung, and do the, help you with the picture and the Lebenslauf and the grammar and all these things. We are not Germans, so our German language is not 100%. But as I said, anybody who opens the Bewerbung doesn't care if you're a German or you're not a German. They only care how have you written your Bewerbung, or is it even interesting to invite this person for the interview. So guys, those people who get help from the government, you can go to the Arbeitsagentur and let them know that you want to do the nursing course, and then you don't know how to write the Bewerbung. They will definitely give you a job coach who will go hand in hand with you with everything from A to Z. They are going even to, they're going to train you even for the interview, which is so important. For those people who are not getting any help from the government, guys, just try as much as possible. Use your money and look for a job coach. This is just so important. There's nothing too expensive when it comes to such a good career which you're going to earn a lot of money in the future. Invest in that. We have a lot of job coaches around, even in our African communities. You can look for them. They can really help you with this. Today, let me talk more about the Bewerbungsgespräch. The Bewerbungsgespräch, as I said, is the main interview. For the main interview, guys, first and foremost, you have to be prepared for questions that can come to you from that side, from the nursing school side. You have to prepare yourself also physically, emotionally, and all that. How you are going to be dressed on that interview day, it really matters. If it's your hair, let me start from up. You can open, you can leave the hair open. You can try and let it not be too much like you're going for a party or something. Maybe try and do a bun, or maybe just leave it, but it should be neat. Don't put so much of makeup. Maybe you can just brush yourself with some powder. No lipsticks on all those things, just leave them. Don't put so much of jewelries, like you have big earrings, and you have those big chains, gold chains, and bling. Try and leave them at home. Those ones you can wear them outside. Don't put so much of perfume. Actually, don't put even perfume, because there are some interviewers who are really sensitive to that. Maybe you might come, with this very little perfume, and then the person is already like, even maybe you might meet a pregnant interviewer who doesn't really tolerate the perfume. So they will be like, even this person should go out very fast for me to breathe well. Dress very well. Try and cover everything, don't go open like the way I am right now. I'm at home. So don't go open like this. Try and cover. If it's such a shirt or dress, try and cover it. Let it be closed, that you're so, you're presentable. Like now in summertime, don't put those shorts, hot pants, and all those things that are showing your body. For us Africans, we are blessed with bum. Don't put so tight trousers that you are showing all your bum. Nobody is interested in this moment. This one is your career. This is an interview, a very important one. Just wear a shirt, maybe a well or even a short sleeved shirts, especially now in summer, and cover yourself so well, guys. When you come in the room, people are seated there. Now during Corona, I understand you're not supposed to give the hand, but before Corona, you had to, you just go in and introduce yourself. Hello, guten Tag, ich bin Joyce, let's say, and then the interviewer will be like, oh, herzlich willkommen, können Sie sich hinsetzen. Don't sit down before they give you the seat. Don't enter and pull the seat and sit down. My sister, my brother, 9. You wait for the interviewer to give you a seat, and then you say thank you, you sit down. Yeah. And when you're sitting down, you know also how you're sitting down. Don't go you when they give you the seat, just sit down like a madam. If you're a guy, sit down like a guy. Don't make such kind of poses or such kind of poses like you're the boss. Try and sit upright. And then the eye contact is very, very important. Watch in the eyes of the interviewers. Don't watch down, or when you're talking you're like, I don't know what. Make sure your phone is off, that no kind of noise will come from your phones, or maybe even phone calls. If it's guys, don't wear caps, leave them outside. Try that your hair should be, if you have, some people have dreadlocks, try and put the dreadlocks really back. If your hair is shaggy, try and go to the salon and cut the hair down. Be very well presentable. The kind of questions that they can ask you is, why did you choose to do the nursing course, or why do you want us to take you in our school? If they ask you that, why did you choose the nursing, tell them your passion. Maybe like me, as I said, yeah, I chose the nursing course because this is a course that is really a passion for me. I have grown up in the hospital. My mom works in the hospital, and I really love helping people. Even in the hospital those days, I could help a lot of patients. And socially, I like communicating with people. I like talking to people. This is a job that is definitely for me. And then they will ask you, why this school? You can try and mention, I chose this school because maybe I did a practicum in your house. Like for me, I did the hospital and the school, they were together. So I did the practicum in the hospital and the school was outside. So I mentioned, I was like, I did the practicum in the hospital, and I loved even how I saw the teachers coming from the school to come and check on the nurses who are those days doing the nursing course, and I felt so comfortable. You can also mention also the school is very near and close to my house, that I don't need to drive so far to go for the school, and those kind of things. The other thing is, you can also mention, like, if it's a big house that you have, like, most of the university hospitals, they have a wide range of patients, they have a wide range of departments. You can say, okay, I chose, let's say, Uni Essen, because you guys have a very wide range of departments where I can really learn a lot more than a small hospital with, let's say, like 500 patients. The other thing that they might ask you is, what is your strength and your weakness? If it's your strength, mention what strength you have. If it's your weakness, don't shy off, you can mention it also. Yeah. The other thing they can ask you is, can you work as a team, or do you like working alone? Talk about team. In the nursing course, team is everything, because no matter how much you want to work alone as a nurse, definitely later, after you do the Ausbildung, you can decide maybe to go and work somewhere where you most of the time you're alone. But even that one, you still need to communicate with the doctors, you still need to communicate with them, with the sanitate's house, you still need to communicate with the insurance. So team is everything. Just talk about that. You like communication, you like being social, and you like team arbeit. You take critics positively, because critics will help you. learn. If it's a mistake that you did, you will learn from it. So teamwork is everything. They might also give you a question, a tricky question. Let's say a patient was discharged and this nurse forgot to give the patient medicine. How do you go about it? So how you go about such a case is, you don't go blaming the nurse. You try and calm down and maybe talk to the nurse and tell the nurse, oh, you forgot to give this patient the medicine. Maybe have you called the patient to tell the patient that she needs or he needs to come back for the medicine? Or even the Heim, let's say they are living in the home care departments, have you called them to tell them that they forgot this kind of medicine to come and pick it? They can also ask you, how do you find the health system of Germany? Do you find it to be okay, or is there something that you think that could be changed? What you can say, guys, don't be afraid to talk about everything. And it's true. It's like when they ask you about the health system of Germany, maybe you can say, yeah, I like the health system of Germany. Das gefällt mir sehr, sehr gut. It's really nice because you don't need, like many other countries, you don't need to go and pay for the hospital before you're treated, and then the insurance is put in to come and cover your cost. And then you can also say what you don't like is the low payment of nurses and the healthcare workers. They are even happy when you talk about it because they know that the government is really not considerate when it comes to the payment of health workers in Germany. Be open, say that nurses deserve, or even healthcare workers, they deserve more than they are getting paid now. And you only hope that one time the government is gonna realize and give them credit. How do you give bad news to a person? Maybe how do you give bad news to a family member who has just lost their family member? So you can say that you try to calm down and not be so emotional. We are also human beings, but in our profession we have to be professional in everything that we do. You can go and cry behind the doors and all that, but most of the cases, if they ask you like that, you just say that you call the person and ask them where maybe they are. Not that maybe they are driving and you give them the news that your mother is dead or your husband is dead. You ask them how they are, and where they are, if they can talk on the phone without any kind of problems. And if they say no, maybe I'm driving, then tell them that please maybe try and stop in the next place and then try and call us back, because we need to talk to you. Is very important, because they want to see how you will react even when you're a nurse in the future. There are some schools, I heard, for me I didn't have that. There are some schools who give some mathematics questions, and people had to do those questions. It depends with where you go and apply for your job. There are some of them, they can really give you some questions that you have to answer, and they can even ask you, where is the heart, or how does the brain function. The other thing also that could be asked is, what do you think about the nursing course itself? Are you flexible? If you have kids, maybe you wrote in your Bewerbung you have kids, they will ask you, how are you going to do with your kids? Because this is a course that you have to do the night shifts, you have to do the late morning shifts. How have you arranged? You can talk about maybe how you have arranged. And that's why I said on my other videos that try and go to the Jugendamt, try and arrange your kids, how they are going to be picked up, who is going to pick them up, who is going, maybe when this one is sick, who is going to come and help you. So try and arrange those things before you go for those interviews. So when they ask you, maybe you can say, ja, ich habe zum Beispiel, you can say, ich habe 2 Tagesmüttern schon organisiert, der Papa ist da, the Oma ist da, maybe the aunties are there, and they have my back, and in case of anything they can move and go and pick the child. Try and talk about it. If you really don't have a very good support system, don't shy off to talk about it. You can say, maybe ich habe eine Tagesmutter schon organisiert. Manchmal kann sein, dass manchmal dass sie fehlt, aber ich werde schon hinkriegen und gucken, wie ich dann am besten machen kann, damit ich nicht so viele Fehlstunden habe. Definitely in the nursing course you are allowed to have the Fehlstunden or the minus hours. There are some in the whole 3 years. There are hours that you're not allowed to exceed. So they definitely know we are all human. Even you yourself, when if you don't have a child, you can get sick and you take Krankenschein, which is allowed also. You need to take care of yourself. You need to take care of your kids. So we are human. So they understand that. What Weiterbildungen do you think you want to do, or how are you going to expand your career after the 3 years? You can say you first of all you will do the Ausbildung, and during the Ausbildung you're definitely going to see a lot of Weiterbildungen that are being offered, and you will definitely go with where your heart and your passion is. If your heart is you want to do those stroke nurses, you want to be a respiratory nurse, you want to do the wound management, you want to do something pediatric, you can choose. You can tell them that one you're really first of all going to concentrate with the Ausbildung. When it's done, then you're going to look for the Möglichkeit or where your passion is, and then you do the Weiterbildung. Yeah, and then what they can ask you also is how much do you think a nurse earns? Like for us, we are living in North Rhine-Westphalia. Try and check maybe how much a nurse earns, so that you have the kind of the amount that you think. They can also ask you how much do you think a nursing student earns. I mentioned about it. You can really Google and check about the how much you earn. Yeah, they can also ask you, have you experienced being in a situation where there was a lot of blood, and how did you handle it? This is where now they want to check your hygiene, or do you know anything about hygiene? You definitely will say anywhere there's blood, you need to wear your gloves, so because you don't know if the blood is contaminated, for you also not to get contaminated. They can also ask you, have you ever experienced an emergency at work or even at home, and how did you handle it? That one, then you can say if it's at home, let's say something happened, a child fell down, try and say that first of all I tried as much as possible to be calm. I went and helped this child maybe wake up and checked if there was any kind of life-threatening what do you call it, injuries. Yeah, if the child or the person was not responsive, how you call the ambulance, and you mentioned even the number of the ambulance that you need, all those kind of things. They can also ask you, where do you see yourself in the next 10 years? As I said, you can say what maybe Weiterbildungen you want to do. Even some of us or some of the people want to study more. Some people want to be doctors, they just start with nursing and they want to continue with their career. Just talk about it, where you see yourself in 10 years. Yeah, I think I have mentioned most of those things that can be asked. In case anybody, I have a lot of nurses here in my forum. In case I have left, there are a lot of things that can be asked, guys. A lot of things. I just try to put everything together, but if anybody knows maybe something different that was asked that I have not mentioned, please just put it down in the description box. I'm not the only person who can give tips. You guys also, I need you, especially those who are already nurses. I need you to come and help our sisters and our brothers, to be prepared as much as possible. We need to strengthen our people, because we didn't have this chance. So because now we have a lot of platforms. We should try and help our people as much as we can. And believe you guys, people are really being encouraged by everything that we are doing, the way we are coming out. Don't worry about views, how many people have viewed your video. As long as one person viewed a video, all those young YouTubers who have come out and are giving good advices, as long as one person has viewed that video, you don't know how you have changed the life of that person. So don't give up. It doesn't matter how many subscribers you have, it doesn't matter how many people are viewing, but as long as one person has viewed that video, you're definitely changing lives. I'm so happy for all the upcoming YouTubers who have been really giving good information. Today, let me shout out on Anne Mudone Waweru. You can check on her YouTube channel. She has also talked about how you can buy a house in Germany. Those are the kind of videos that we need. Those are the kind of motivation that we need, you know, so that we can get more information. The information is getting more open to us Africans. Let's not keep anything that we know that can help the other person. Guys, this is the time to open up. This is the time to hold hands and really give chances to everybody else outside there. You can also check on Essie Beyonce. Essie Beyonce has also a YouTube channel. I'm going to link down all the links on the description box. Check on her YouTube channel also, and you will learn a lot. Anything you want to achieve, you can always be, guys. So people, my people, let's always hold our hands and really help each other where we can. This video, I don't want it to be so long, and thank you so much for your continued support. Yeah, definitely I'm going to do more videos, and in case you think there's any information that you need from me, just write me on the description box. Maybe the next video that I should do, I will definitely do it wholeheartedly. Thank you so much, guys. Have a wonderful time in a nice summer. God bless you. Mwah.